Hey, Keto Freaks. Here's an update on Keto Fest. We have a date, the weekend of July 15th and 16th, 2017. Keto Fest is a ketogenic festival for everyone, not just doctors and nutritionists. Richard Morris and I, along with a host of keto rock stars, are turning the entire coastal town of New London, Connecticut, ketogenic the entire weekend of July 15 and 16. Some of the best minds in keto have already said they want to come and speak, including Jimmy Moore, Megan Ramos, Ivor Cummins, Dr. Jeff Gerber, Dr. Eric Westman, and Dr. Ted Naiman. We'll have an outdoor food festival with live music, fitness lessons, cooking lessons, walking tours, bike tours, Segway tours, movies on the historic Guard Theater's 60-foot screen, and of course, great talks by our rock stars. We'll be doing a Kickstarter campaign soon to sell tickets. Meantime, go to ketofest.com and register. Keto Fest, real keto for real people. Welcome back to Two Keto Dudes. This is Carl Franklin from Connecticut in the United States. And in February 2016, I put myself on a ketogenic diet to take control of my metabolism. In just 2.5 months, I managed to reverse all my markers of type 2 diabetes with diet alone. As of now, I'm 80 pounds lighter with no signs of diabetes or heart disease.
Hi, I'm Richard Morris in Canberra, Australia, and I've been on a ketogenic diet for almost 3 years. When I started, I was very sick with complications from type 2 diabetes. Within 6 months of starting a ketogenic diet, all of my biomarkers of disease had disappeared. I've also lost about 80 pounds, and I've completely turned my health around.
Absolute coincidence, Richard. Well, this show is a document of my progress through nutritional ketosis and Richard's experience thriving for 3 years in nutritional ketosis.
Yeah.
And hopefully that might help a few people who are curious about this kind of dietary hacking.
Yeah, we're not doctors. We don't want to give anyone any medical advice, but we are keen to share our own experiences. We're actually both software developers, so we're not afraid of a little technical detail, are we, Carl?
Nah.
We have done some research into our own deranged metabolisms and the science behind that. And we hope to share some of that research. Where possible, we intend to put links in the show notes to cite research supporting any claims that we make.
And you'll probably work out pretty quickly that we're both foodies.
Oh, yeah.
We love to cook and we love to eat. In every episode, we both share a keto recipe that cannot be ignored.
Oh, no, it cannot.
So let's start podcast number 52, Weight Loss Surgery. Well, Richard, do we have any corrections or apologies from last week?
No, I don't think we have any corrections. I tell you, Ivor knocked last week's episode out of the park.
Oh, yeah.
I would suggest to people check out his YouTube presentation. He used the audio from our show and then added it in his own slides. Mm-hmm. So do a search on YouTube for adipose in insulin resistance, or just check out our show notes. We'll put a link in the show notes.
And speaking of YouTube, Two Keto Dudes is now available on YouTube. Every single episode, you can go to our channel. It's youtube.2keto.com.
Nice.
Yeah. So let's revisit what a ketogenic diet is. A ketogenic diet is any diet that puts you in a state of nutritional ketosis.
Yep.
And people have different ways of doing that, but one surefire way is to limit your carbohydrates to just green leafy vegetables, maybe a few nuts. Keep them around 20 grams or less per day. And you want to replace all the carbohydrates in your diet with fat.
Yeah.
And your protein should pretty much stay the same. The amount of protein that you need scales with the amount of lean body mass that you have.
Yeah.
So there is pretty much the calculation we go by is we eat 1 gram to 1.5 grams of protein for every kilogram of lean body mass that we have.
Yep.
The rest comes from fat.
All our energy.
Yep. Well, Richard, this is going to be a great show, but before we get into it with the ladies, how was your week?
It was actually pretty good. As you know, I've been dealing with this knee injury and it's kept me off the bike. I am going to go out once around the lake tomorrow, which will probably be about 20K. But it's the knee injury is really kept me from exercising. I did go to physio this week, and they did something new, which is called dry needling, which is a little bit like it's like a kind of acupuncture. But what they're doing is, because my problem is tendinitis, it's all the quadricep muscles are tight, and they're normally supposed to be elastic and relax as the joint moves. But because they're tight, that puts pressure on the tendon, and that's what has caused the inflammation. So what they needed to do was to release the muscle. So he stuck these needles in, and all of a sudden my quadriceps started twitching. And that was, the needle hitting the nerve, and basically that twitch is the release of the tension in the muscle.
Neat.
My knees have felt great ever since.
Wow. How cool is that?
It's fascinating. And the other thing that's happened to me this week is I'm continuing on with my low-protein adventure. Mm-hmm. We said at the beginning of the show that we keep our protein between 1 and 1.5 grams per kilogram of lean body mass. Mm-hmm. But for just this month, since January 1st, I have been limiting myself to 0.84 grams of protein per kilogram of lean body mass.
Yeah.
Which for me is about 67 grams of protein, so it's really low.
So how's that going for you?
It's actually going really well. My glucose is down and my ketones are up, which is a good thing. Mm-hmm. And the other thing that's important for me is that by going low protein, I'm starting to get protein signals. So I'm starting to get signals that if I'm a little bit below 67, if I'm like, say, 58 or so, because you can't always guarantee that you're going to get 67 grams of protein in the food that you cook, because, we can't really calculate these things exactly.
Right.
So if I'm slightly below, I'll get a real craving for something savory. And it could be just like a couple of slices of salami, maybe 3 grams of protein is just enough to get me over the limit. And all of a sudden I lose the cravings, and I don't feel hungry at all. So I'm really able to dial in my protein signaling, my protein hunger signaling. Yeah. And it seems to be around about that 67 to 70 is about my ideal minimum amount of protein.
Wow, that's great. And as you've said many times on the show, you're going to do bookend DEXA scans before and after to see your lean body mass and to see if any of it has been lost, right?
Yeah, and also I'm going to do a blood test at the end of it. And at the beginning, I did a blood test at the beginning because I wanted to see what my blood urea nitrogen levels are before and towards the end, to see whether that changes. In theory, if I reduce the amount of protein to the point where I'm in nitrogen balance, that will go down slightly. I'm currently at the top of the physiologic range for that.
Yeah. So
I was probably eating too much protein, between 1 and 1.5 grams, which I've been doing for the past 3 years. That may have been too much protein for me, and I may have just been basically throwing the furniture on the bonfire because it was just excess. But anyway, so that's my week. How was your week?
My week was great. As I mentioned before, I've been eating during the day and not at night, and that works really well for me, except when something comes along and I have to have dinner instead of lunch. Yep. And it's really throwing me. I had a community keto dinner at my house that I've started this on meetup.com, basically for local people who are interested in keto stuff to come to my house for dinner. I made the Cuban roast pork.
Oh, nice.
Let me tell you, it was not fat sparing at all. So here I am eating all this fat right at the end of the night, and put on some weight. So this is interesting to know that just because you're eating keto and you're fat to satiety, well, if you go over satiety and you eat more after you're already full, you're basically going to wear it. So
yeah,
that's what happens.
Pretty much. Yeah.
And but the benefit of that is, as compared to overeating carbohydrates, it's very easy just to go back to doing what works.
Right.
And as opposed to having cravings and raising your insulin, and now you've got to tamp down that beast again. So, it was worth it to me. And especially it was worth it to have Deborah, who was my guest, be introduced to all this delicious food.
Yeah. No, that's awesome.
So, yeah, it was great. Well, that brings us to our topic today, and we have 3 esteemed guests, all of whom are moderators or administrators on our forum, www.ketogenicforums.com.
Yeah.
And before that, they were administrators in our Facebook group, which is now closed. So I would like to introduce Dr. Louise Reynolds, Daisy Bracken Hall, and Donna Lordy. Hi, Daisy.
Hi, Carl. Hi, Richard. Yes, indeed. I'm British, you should
British,
say.
Yes.
Yes.
Louise, hello.
Well, g'day, mates. How you going?
Great to have you on.
Thank you so much.
And Donna Lordy, how are you?
I'm doing very good, Carl. Thank you so much.
Great. Well, the reason that we asked you all here is because you've all had experience with weight loss surgery. And I think your stories need to be heard because they are each unique and individual and very, very interesting, especially because you all found your way to keto. So, Louise, why don't you tell us your story?
Okay. So my weight gain and weight loss story really begins thinking about my relationship with food. Food has always been a really big part of my life. Like many families, we celebrate food at special occasions like birthdays, holidays, such as Christmas and Easter. My paternal grandparents always had food prepared when we came and visited them. My grandmother was such a wonderful cook. Her sweets, her cakes, and her plum pudding, her Christmas plum pudding, was something that made that time so special. The cake was rich and dark and fruity and served with lashings of cream and custard.
Bring us a figgy pudding and bring some right here.
That's right. So I try and make it. It's not quite the same, but this was served after we had heaped plates full of turkey and roasted vegetables. So that food coma was well deserved.
Yeah.
It wasn't really until the birth of my son, which was in a really unhappy marriage, which later ended, of course, that I gained most of my weight. So, like your esteemed Dr. Phil says, I was having that party in my mouth and eating my emotions. Yes, Dr. Phil, that's for sure. And, of course, it wasn't working for me, but I haven't got the Texas drawl to do that.
What were you thinking?
It's not working for you.
Right.
Anyway, so the emotional roller coaster escalated with family court matters, dealing with custody issues, which really resulted with me being a full-time single mom of my son who has various learning disabilities.
Wow.
And this was all the while working full-time and doing my doctoral dissertation, so life was one big messy ball of stress.
You're a superwoman.
So, well, I'm doing the best I can. Anyway. So I tried all manner of things. I did the obligatory Weight Watchers. I was counting those points. I was drinking them shakes. Me and Jenny Craig became best friends. I did the Ducan, you know. Anyway, the shakes were an interesting experiment in the sense that they were low carbish, but obviously I needed a lot more fat in the program. And this worked well. I lost about 15 kilos at that time, but of course it wasn't sustainable, and I'm not as knowledgeable as I am now about the true science behind eating ketogenically and knowing what I know now.
Yeah.
But I was still trying to get a better understanding of my weight issues, and my usual approach, like Donna and Daisy, would like to over-intellectualize things. Being a former paramedic EMT, and then I became a university lecturer, I was always looking for reasons behind why I was increasing my weight gain.
Right.
And, of course, conventional wisdom, calories in, calories out.
Oh, yeah.
So, like Richard, I had that physical trainer punish me 3 times a week.
Mm-hmm.
So,
yeah,
sure, the exercise did make me feel better, but it never really shifted the ever-increasing weight. The irony of the situation was that I was, Dr. Lou, the intelligent, overweight woman, teaching about healthcare and healthcare systems, healthcare policy, was standing out the front of very large freshman first-year classes, and I wasn't practicing what I was meant to be preaching about being empathetic and understanding about healthcare needs.
Yeah.
So there I was using my university contacts. I knew of the eating disorder research unit at my local campus, and they were real leaders in this area. And I asked them for some contacts for a therapist, and this changed my life. The therapist used cognitive behaviour therapy to understand what my triggers were and really raise consciousness about what those food patterns were. Unpacking this meant that I went back to what my food values and beliefs were, and much of that was around childhood, and food was a social thing rather than a nourishment thing, which was a real revelation.
Oh, right.
So shifting my thoughts and feelings and behaviours to better manage those identified stresses in my life and how I was using food to, as Dr. Phil said, eat my emotions,
Right.
which were mostly carbs, and they were easily prepared, accessible, rather than actually nourishing my body.
Yeah.
So how did I get to the weight loss surgery decision? It wasn't easy, but again, being who I was, I researched the literature, what my choices were. I interviewed 3 different surgeons and basically asked them, what is it they're going to do? I took along the research papers with lots of sticky notes and highlighted text because I wanted to show them I was serious about what it was that I was going to do for the rest of my life.
Wow.
But how that came up was a colleague who also had a vertical sleeve gastrectomy, and she had great results, and that was a real inspiration to me. So I went and consulted with her surgeon, which I did. So at that time, I was nearly 300 pounds, which was about nearly 130, 134 kilos.
Yeah.
And was finding it just so hard just to move around and do things. So nothing was working for me in terms of ways of eating or diets. I felt like I'd tried everything, and after 2 years of therapy, I really needed to get a better handle on the management of my mental health and stress, and this was the one last option I needed to try. I knew that I didn't want a lap band or gastric bypass from my research, and I wanted a permanent option that allowed me to eat what I wanted to eat and be able to control that portion size. So I later learned the difference between abstaining and moderating. So if anyone's interested in Gretchen Rubin's work on habits, that was really key for me, and I definitely need to abstain from certain foods.
So how did the weight loss surgery work? I mean, how did you lose weight for a period of time? What was your experience with it?
So at that time, before really going low carb, I had lost, I got to about 90 kilos. So I had lost around about 40 kilos in weight loss.
Wow. But the diet that you were eating was still high in carbohydrates, so you were hungry most of the time.
Yeah. So I was still eating regularly, and certainly a carbohydrate diet.
Yeah. Did you find that over time your stomach expanded to allow more food, or did you have problems with vomiting like we know Lino had?
No, definitely not. I see that the weight loss as in terms of the weight loss surgery is the tool, and I needed to look after my sleeve, and it will look after me.
Yeah.
And it's certainly as a tool. No, I've not had any adverse effects. I didn't actually have any vomiting. I've never vomited from, obviously, other things apart from alcohol.
Yeah, sure.
But no, there was no complications.
Okay.
I've had an unremarkable recovery, and it's been absolutely I'm absolutely rapt with what the outcome has been.
So thumbs up for you.
Yeah, most definitely. But in terms of where I am now, in terms of shifting, the next lot of 20 kilos has really been focused on the way that I'm eating now,
right,
in terms of low carb.
Okay.
And do you find that low carb works naturally with the vertical sleeve?
Most definitely. And I think, I know that Daisy has posted this a number of times about how it's sort of like a hand in glove and it fits so nicely. And it's really worked well in terms of, hunger management and feeling, obviously, the fullness and eating to satiety and really those hunger signals. After the sleeve, Obviously, part of the stomach that they cut out, and I'm sure that Donna can talk more to this, is where they cut out the ghrelin part of your stomach. And for I don't know how many days or even weeks, I wasn't feeling hungry at all. It was quite unnatural.
Did you say the ghrelin part of your stomach?
Correct, the ghrelin part.
The
So
part,
where
the part that
is
signals ghrelin, yeah.
Oh, the part that signals ghrelin. I didn't even know there was a part that signals ghrelin. And ghrelin is the hormone that is a hunger hormone, right?
Yeah, Donna can talk to that.
So ghrelin is interesting, actually, because it and growth hormone share the same receptors. So, for example, Carl, like a lot of people who are listening know this already. When you fast, what hormone peaks significantly? Well, it's growth hormone. And, they don't quite understand the mechanism for hunger. Everyone will tell you it's the hunger hormone, but it actually does a lot more.
Okay.
But yeah, so most of the ghrelin cells are in the stomach. Actually, in infants, they also produce it in their lungs. And that's what contributes to lung development. And so we have some residual cells in our lungs, still not very many, certainly.
Wow.
But the stomach still does produce some ghrelin. And they've also found that some of the islets of Langerhans in the pancreas also produce ghrelin. That's a very recent development, though.
Okay. Well, we'll let Louise continue with her story and we'll get back to ghrelin. That's great.
All right, so there's not too much more to go. So my low-carb journey is a real credit to my mom, and she started with Tim Noakes and Banting in early 2015. So she really planted the seed of the ideas about lowering carbs and increasing fats, which was a real shift in her thinking, obviously dieting from the 50s and 60s, about obviously calorie deficiencies, about the way of eating as a lifestyle rather than a diet. So I took on a lot of those ideas over that summer and really wanted to change the way my new family were planning and preparing meals, and especially because I was so appalled at how much processed junk we had in our pantry, and really getting back to basics and eating real food. But what became more apparent was my new partner, Andrew, and his son, Aaron, having various medical issues. And they both consulted an immunologist or an allergist who had a strong interest in metabolic syndrome and insulin resistance as part of those medical issues. So Andrew had long-standing allergies, and Aaron has eosinophilic esophagitis, which the allergist drew back to, is insulin resistance. Wow. So Aaron is only 15 at that time, and he actually had a Kraft assay, which was really interesting to see and map out that a long, slow response to the glucose that he had. So last week, Ivor is dead right about the early commencement of his patterns long before a type 2 diagnosis is made.
Yeah.
So we have now 3 teen boys trying to get them to eat low carb, which is a real challenge in its own right, with young men with disposable income, who two of which work at Burger King. So fast food being cheap. I know, cheap and accessible. Those frozen Cokes will kill you every time.
I don't think I could work at Burger King for 15 minutes. I wouldn't last 15 minutes.
No. Well, they do make bunless burgers for me when I ask for it, so that's fine.
Good.
So keto for me is obviously a natural progression from the low carb, is about healing the damage to my body, both from the years of disorderly eating, but about the physical injuries I sustained from my motorcycle crash in May 2015.
Oh, my.
So, yes, Donna, you have to give me a gold star for my overachieving. I sustained 11 broken ribs, 2 punctured lungs, a broken shoulder, a fractured sternum, 3 fractured vertebrae, which resulted in me having a 5-hour spinal surgery, a day in an induced coma, then 5 days in ICU with multiple blood transfusions, and now my lengthy rehab. So keto now.
I just got to say, just got to say, ouch.
And and congratulations for enduring all of this. I mean,
Surviving
you really are Superwoman. Seriously, what a heroic feat.
Well, I'm a lean, mean keto machine. So with my rods in my back, and so it's about healing the inflammation. And now I'm coming up to nearly 18 months, and I'm off all my pain medications.
Yay.
I'm doing my strength training using my 5x5 Strong List app, but not quite
Nice.
to my hero, Brenda Zorn.
Yeah.
I sort of look at her weights and it's just amazing.
She's amazing.
I know. My total weight loss now is 60 kilos or
Yeah.
132 pounds. So feeling fit and strong and managing most days, 1 meal a day with intermittent fasting. So my goal is to lose more body fat percentage and build more strength in my back, of course. But it's not really worrying me too much what the scale says. My clothes are fitting fine. So
Wow. That is an amazing story. And what an adventure you've been on. Oh, my. And
Yes.
you came to a good place.
yeah, but you guys, I tell you what, and thanks to the superb recipes, I make my own bacon. With my
Nice.
new Christmas present of my wood smoker,
All
my
right.
kitchen gadgets, thanks to Carl, medical devices.
That's right.
And I just got to put a plug out there. Instant Pot have to make a 240-volt plug. You know, if I need a capacitor converter the size of a small machine, Instant Pot need to come to Australia. So,
There are other
totally
kinds
agree.
of Instapots besides Instapot, though, right? That's a brand.
well,
You can't fry foods in these ones you get in Australia.
Huh.
yeah,
Oh, well.
we looked at a capacitor thing and it just wasn't going to work. But next on the list is a sous vide. But I did give my mum one for Christmas, and she's doing a great job, you know, test running everything for me. So,
And you are Dr. Louise Reynolds. What is that all about? What is your doctor in?
business and management, and I was the first Australian female paramedic to undertake doctoral studies, dissertation studies.
Wow.
And so that was back in 2008 when I finished my PhD, and so
Fantastic.
I'm just trying to do the best I can. But thank you to the dudes for making me an admin. It's been so inspiring.
Well, it's just great to hear all these great stories, and you know, we didn't invent this stuff. You did this work yourself, and you deserve the credit. So well done.
You came to the same
Thank
place
you.
that we came to with the same research. So well done, you.
Oh, thanks.
Okay, let's hear from Donna next. Donna, how are you?
I'm doing good, Carl. How are you?
I'm awesome, and so is Richard. I take it.
Yeah. I'm just sitting here quietly listening to these stories.
Yes, let's hear yours.
So tell us, Donna, how did you come to weight loss surgery and keto?
So I actually sort of did things backwards. My original weight was very high, and I had almost no mobility. I actually weighed over 750 pounds.
Whoa.
Yeah, this was many, many years ago. And,
Wow.
you know, when you can't move around, obviously they're like, you should exercise. Well, no.
Yeah.
I mean, you can't even freaking cook. So, by the way, I'm from New Jersey. I'm trying not to curse. Just a little.
No, that's all right. We can bleep you. It's okay.
Yeah, we've had Brenda Zorn on the show. We
We
can
had
talk a
Jason
little
Fogg
bit
on
of
the
Jersey.
show.
You should hear
He
our phone
started it.
conversations. But anyway, no. So, you know, obviously you can literally not walk more than a few feet. And what happened was my weight gain occurred for a couple of reasons. One, I have, and I don't mind, I talk about it publicly because it reduces stigma, I feel.
Yeah.
I have major depressive disorder, which is, it was very bad at one point. Now I haven't had an episode for years, which I actually credit the ketogenic diet with. And I also have an eating disorder called binge eating disorder, obviously. But I found that most people in my situation do have a behavioral disruptance of eating. But that's another show probably. So anyway, at 750 pounds, I'm like, look, I'm basically going to die. I mean, there's no way to put it. You know, I'm not going to see 35 if this keeps up.
Yeah.
So I did a lot of research.
And you were pre-med at one point, weren't you, Donna?
That was actually like 20 years ago in my misspent youth, and I left medical school to run away and get married and move to Chicago. By the way, don't do that. So listeners who are 19, don't do that, just FYI.
Stay in med school.
Yes, same. I actually don't regret leaving med school because I don't like, well, that's another show too. But anyhow, so, you know, I was getting a divorce at the time too. And I'm like, look, something has to change.
Yeah.
And what happened was I had basically a nervous breakdown, and I saw a psychiatrist, and he's like, you're going to therapy. And I'm like, you're crazy, dude. And he's like, no, seriously. And to be honest, that is what saved my life. And the first 2 years that I I was actually on a low carb diet. There was a book called Protein Power. I'm sure people are familiar with it.
The AIDS.
Yeah, and it's a great book still. I mean, some of the work's dated, but it's still a fabulous book in some regards. And, the Eads basically started me saving my life. It was either that or Atkins. And at the time, Atkins was getting a bad rap, sort of. Protein Power was the trendy thing at the time. This was like the mid-2000s or a little later. But anyhow, so basically I lost 200 pounds in the first 2 years on a very low-carb diet. And I eventually transitioned to zero carb for a while because I was at about 600 pounds. I started going to school. And that was an interesting experience, getting your bachelor's degree at 600 pounds. But I did it. And then I went into graduate school. Yeah. And so here I am in graduate school. I'm weighing like about, I think when I started the surgery process, I had gotten down to 460 pounds. By that point, I had been on a ketogenic diet for a while. And I had slower weight loss, but inches wise, I was losing a lot. Like, I think my waist used to be like almost 90 inches, and it's less than half that now.
Wow.
So it's, I can't complain, even though there's a way to go, don't get me wrong, but so here I am in school though. And my master's degree is in clinical psychology, and to complete your degree and to get licensure, you have to do an internship. So, I mean, think about this. So you're like, basically over 400 pounds, and you're going to have to work in a hospital or some other setting. You walk up to 10 miles a day in a hospital, you know? So I was confronted with this reality, and my weight loss it was still consistent, but I was still struggling. And no matter how I ate, even on zero carb, my A1C was still too high.
What had your A1C gotten up to?
My A1C at the highest was 11.2.
Oh, me too. That was my apex too.
It's not creepy or anything, but anyhow, so right now it's a 4.8, which is very good.
That is amazing.
Yeah, I mean, and so that part of that surgery, so before the surgery, it was about 6-ish, and a year after surgery, it was 4.8.
Okay. And how did the surgery work for you?
So I also have the vertical sleeve gastrectomy. Originally, I was going to get the duodenal switch surgery, because for a higher weight, usually that's considered to be the best in terms of long-term outcomes, 5 to 10 years. Because it's really easy to lose weight when they cut out an organ and you can't freaking eat anything, right? So you want to look at 5 to 10 year results for anything, because that shows durability.
Yeah.
The problem is it's very severe, and I can post more about it on the forums, but you end up with severe malabsorption, which isn't a problem if you supplement, but you basically have to take like $100 of supplements a month.
Right. For life.
Malabsorption being the inability to absorb nutrients?
So with the duodenal switch, yes, it's nutrients, it's micronutrients, so vitamins, but also macronutrients.
Wow. So
the surgery basically requires you to follow a very high protein, high fat diet, because you do not absorb a significant amount of fat or protein.
Wow.
That surgery, it's relatively unique to that surgery. The interesting thing about it is most of the satisfaction post-operatively, I talked to something like 100, I'm really a dork, right? So I talked to like 100 people who had it, give or take a few, and only 3 were dissatisfied with it. And I'm like, this is crazy. This is some crazy shit. Oh, sorry. Because, if you think about it, it's really extreme, right? You have, a lot of people will have bowel side effects for a while. There's something you can get with malabsorption called short bowel syndrome. And, we'll see it with a lot of other surgeries, and it can be very life affecting. And people are like, yeah, we don't care. It's freaking awesome. And I'm like,
yeah,
that's interesting. As a therapist, that's very interesting to me. But the procedure we have, the vertical sleeve gastrectomy, was actually initially done as the first part of that surgery. And the surgeon I worked with, he's an amazing surgeon. He said, Donna, before I even consider doing this operation, you need to remember, I could literally kill you with this surgery. This is a major surgery.
Whoa.
You have to change all your habits permanently or it's not going to work. And he's like, you have to have tried everything before we do this. And a lot of surgeons don't necessarily do that.
Yeah.
But I actually had an appointment with the University of Chicago to get the switch. And based on what the surgeon told me, I'm like, you know what? I'm going to go with this guy because when he's honest, and 2, he's conservative. So my surgery went very well. They actually did it in less than an hour. And the interesting thing, and I had talked to Richard a couple of years ago about my liver. So normally when we're obese, we have a very fatty liver.
Right.
And it takes quite some time to reverse. And it's called now an alcoholic fatty liver disease. Well, when they did my surgery, my liver looked perfect. It looked like I had never been obese. And the surgeon credits that to me having been on a ketogenic diet and a low carb diet for so long.
Sure.
I thought that was interesting.
Nice.
That is interesting.
Donna, could you give us a quick sidebar on the different kinds of weight loss surgeries?
Okay, I'll save the lap band for last because I hate it.
That's what Lino had.
That's right.
Yeah, don't ever get the lap band. I mean, so the first most common surgery now is the vertical sleeve gastrectomy. And I think that's what the three of us have, actually.
Right.
It is very well tolerated, which means that after surgery, you can pretty much eat anything in the sense of tolerating food. Some people do have food sensitivities, but for the most part, you can eat normally. About a year after the surgery, what happens is the sleeve swelling goes down. So your capacity does increase. But as we all know, it's not how much you eat that matters typically. It's what you eat.
Yeah. And when.
Yes. So this is a webbing that's wraps around the stomach to compress the size of it.
No. So actually what they do for the gastrectomy, they excise or remove 80% of the stomach permanently. So normally your stomach is shaped like a kidney bean.
Yeah.
Right? Yep. So what this does is it cuts off the back part of the kidney bean called the fundus. And the fundus is the part that stretches. That's also the part going back earlier, which makes the ghrelin.
Right.
So you have a permanent serum reduction of ghrelin for life.
Wow.
And that might also prevent insulin production as well. I mean, it's the stretching of the stomach that provokes some secretion of insulin. So removing the part that could stretch probably would reduce that as well.
So it does, and it also alters the neuroendocrine response because eating to fullness and stomach stretching permanently over time, not like once, right, alters the whole neuroendocrine response around fullness, which a lot of people also don't realize. But anyhow, so that's one surgery. That's the safest currently in terms of low side effects, short inpatient stay. You have to watch for what are called leaks in the staple line, which is why you still want a skilled surgeon to do it, obviously. And the surgery is the shortest. The one a lot of people are familiar with is called the gastric bypass, though.
Right.
And the whole name is the Roux-en-Y gastric bypass. And what that refers to is what they do is, so you keep your whole stomach. And I think someone was drunk who actually came up with the surgery because it sounds ridiculous. You keep your whole stomach, but they retain a small pouch of it. So they make a little pouch by where the esophagus is, like this little bubble. The rest of the stomach stays in the body and is connected to the system. And then they bypass about 150 centimeters of intestine. And they start that bypass after what's called the duodenum, which is the first part of the small intestine.
Right.
So there's a caloric malabsorption because, so the less time food is in contact with the intestines, the less macro and micronutrients and energy you absorb.
Right.
There's still carbohydrate absorption. There's still, so all of that. And the problem is that comes back. So the caloric malabsorption and the energy, I should say energy malabsorption because I hate calories, but anyhow, the energy malabsorption returns after, some people say it's 2 years, some people say it's 5. Regardless, it comes back. The malabsorption of iron and other, minerals and vitamins, though, does not.
Right.
So you still have to supplement and you have to watch your labs carefully. That was done exclusively and until I think 2014 or 15, the ASMBS, which is the American Society of Metabolic and Bariatric Surgeons. I'm sure the internet will tell me if I got that wrong, but their statistics, about 200,000 people get surgery a year now and in the United States, and about half of all the people now get the sleeve. Prior to that, it was like 60% gastric bypass and then so much of the lap band.
Yeah.
Which I still hate.
All right.
So the bypass, it's not a bad surgery, but the sleeve has actually outcomes that are the same now that the sleeve has been done for so many years. You still see an excessive weight loss that's permanent, 5 to 10 years of about 50%.
Right.
Wow.
So then there's the duodenal switch, which I mentioned, which this is like, again, it's interesting so about the bypass, interesting story, that was originally invented to treat acid reflux. Which I didn't know until the other day. Yeah. So they found out people were losing weight. They're like, hey, we should do this to fat people. So anyhow, Sorry, I'm a little irreverent.
No, that's okay.
So then we have the
Understood.
duodenal switch. Well, I don't know if that's good, Carl, but anyhow.
It is
so
what
the
it
duodenal
is.
switch has that has what they do is the sleeve gastrectomy, and that one is actually usually twice the capacity of the standalone sleeve. So you can still actually eat quite a bit. So to give you an idea of capacity, the normal stomach when full holds about 32 ounces by volume on average.
Right.
After the sleeve surgery that, for example, me and Louise and Daisy have, it's about 4 ounces.
Yeah.
With the duodenal switch, it's about 8, but every surgeon's different is the other thing that drives me nuts. None of these procedures are standardized for the switch anyway, but that's another show as well. But anyhow, so they do the sleeve gastrectomy first. Then what they do is they completely bypass most of the small intestine. So what they do is they reconnect part of it to the area where the pancreas is. So all of the bile ducts and pancreatic enzymes still eventually encounter the food.
Right.
But what happens is there's a common channel, they call it, between the bypassed intestine and the intestine that comes from the stomach down. And that's anywhere from 50 to 150 centimeters, which isn't very much, actually.
Mm-hmm.
And all of about 4 feet of the intestine on average. Again, it depends. Every surgeon does it differently. And I've heard some surgeons have done what's called a mini DS. Actually, one has, and that was a nightmare because he was actually removing part of the small intestine, which you should never do unless there's no other choice. But anyhow, it's why you always, always, always have to vet your surgeons and be skeptical. But that's another show as well. So anyhow, this causes severe malabsorption, as you can imagine.
Sure.
And about 30% of everything you eat permanently, you don't absorb or utilize in the body. So that's not a problem if you supplement. The issue I have with it is we call it compliance in medicine. And all that means is following the regimen that you're supposed to follow.
Mm-hmm.
And it's very hard for most people with an 8-ounce stomach to eat 150 grams of protein a day.
Right. Yeah.
Never mind the fat. And so also there's an issue where the surgeon departments confuse the surgery. So they'll tell duodenal switch patients to eat low fat, which is crazy because you have to actually eat as much fat as we do in addition to the extra protein. Right.
Yeah, that is
so
crazy.
that's horrible. I mean, it's dangerous is what it is. So it's not a bad surgery, but the support for surgery, frankly, sucks. And then there's a lap band, which should be stabbed and set on fire and never implanted in anyone again.
So this is what Lino had, and he had a horrible process. He almost died on the operating table getting it put in, and then he almost died getting it taken out. It was
that's horrible.
And then he was vomiting so much that became the danger of too much acid and scarring in the throat and the esophagus.
Jeez.
Yeah.
The lap bands, they're nightmares. And they're finding the lap band, and this is even on the ASMBS website, if anyone's curious, they go through all the benefits and disadvantages for surgery. And the lap band has more disadvantages than advantages. And even the duodenal switch doesn't. And actually, people have a higher satisfaction by a severe magnitude with the switch than the lap band, which if you think about it, says something, because they say the lap band is non-invasive. Well, that's absolutely not true.
Yeah.
So the lap band, for people who don't know, it's a band that's inflatable. It's basically like a rubber tube. And what they do is they secure it to the stomach loosely, but they wrap it around. They measure out how much they want the top part of the stomach to hold, which is going to hold food.
Yeah.
The idea is it's a restrictive only procedure. There's no biochemical changes that happen or things like that.
But this is done laparoscopically, isn't it?
So, Richard, that's an interesting. So it depends. Some surgeons will not operate laparoscopically for any of these surgeries, but the best ones will. Like my surgeon will do up to 600 pounds laparoscopically, 600-pound client. Even over that, he's done. So that's the other thing. So I've seen people who've had open lap bands, which I think is frankly also ridiculous, because open surgery is its own issue. But anyhow, so what happens is you have this band on the stomach. Well, a lot of people don't think about this. You're moving around, obviously, because your body moves. Well, your organs move too. This is a very simplistic way to put it. Doctors, again, don't kill me on the internet. But what happens is the band can shift because you're also eating, and the stomach is a physical organ. It masticates food.
Right.
And it moves. And so a lot of times we'll see the band slip, which causes a problem. The band can adhere to the stomach and cause damage to the stomach that's permanent.
Oh.
There's a tube that goes from the band. So you have a port under your skin that has a tube that goes to the band, and they use that to fill it. Well, any of that can mess up So anyone who's ever done work with computers knows the more components that's in something, the more that's basically going to get messed up down the
The
road.
more complicated it is. Yeah. Right.
So I'm much happier when that happens to my computer than my stomach, however.
Your innards, yeah. You definitely don't want your innards crashing.
Well, so another interesting thing about the lap band is you have to get it filled and adjusted. Well, each of those visits is a chunk of change.
Yeah.
Sure.
So maybe in countries that have better healthcare than the United States, which is basically everywhere, it may not be a factor. But here, that adds up. Like, I don't know about now, but like 10 years ago, there were doctors doing it for like $200 a visit. No insurance, right? So you have to go once a month or once every few months, rather. But that adds up. The biggest issue I do have, aside from the complications, is that there's no metabolic benefit.
Yeah.
So all the other surgeries have an instant and non-replicatable benefit that would otherwise take many years to accomplish. Well, a year to many. It depends.
Right.
I mean, it depends.
Through weight loss alone.
Right. And don't get me wrong, you don't have to get surgery to get those metabolic benefits. I want to say that outright. You absolutely do not. In my case, there was that time-sensitive issue with internship number 1, and I needed to lose weight quickly, but I also had stalled for a while.
Yeah.
And I also used to weigh 750 pounds. If I weighed like 200 pounds, they'll do it
That'd
on
be a
me at
different
200.
story.
Yeah.
Well, exactly. So, even 300 pounds is a different story as far as I'm concerned. But, the lap band, though, gets used on lower BMI people. So you'll see people with 200 pounds overweight, like a woman, 5'6", and they'll do a lap band. Well, I think that's a bad idea.
That's unethical, surely.
So here's the thing, and everyone, and you and Carl especially, will understand my critique. It's based on BMI.
Yeah.
Richard. So all the insurance.
Don't get me started on the BMI.
Well, right. So that's what they base it on. So someone who's my height, I'm 5'2", well, 5'1", but I'm 5'2" for the podcast.
That stands for bullcrap measurement index, right?
No, it does. It's ridiculous. So I'm supposed to weigh like 100 pounds. Well, you know what? When I was a size 4, when I was like young, I didn't freaking weigh 100 pounds ever in my life.
Well, Donna, let's get back to your story. That was a fascinating sidebar. Where did we leave off in your journey?
Carl, I have a big mouth. Just tell me to shut up.
No, that's not what I'm saying. I want you to speak.
So I had surgery in June of 2015, and since then I've lost 142 pounds.
Wow.
I'm in the high 290s now, 290-ish.
And how much of that do you attribute to the surgery versus what you eat?
So I actually view surgery like a program. There's an old programmer saying, it's GI-GO, right? So garbage in, garbage out. So you can have a $4,000 MacBook and treat it like a piece of crap. I mean, it doesn't matter that it's a MacBook. It doesn't matter that it's like a $4,000 Alienware PC. It matters what you do with it.
That's
and so
right.
Surgery, I think that for me, the benefit of surgery, one is I have binge eating disorders, so I should always have restricted consumption.
Yeah.
Even though I don't binge, and I haven't in a while, I find it psychologically helpful, number one. I find it physically helpful as well, because I feel much better since surgery. My hunger, before surgery, even on keto, I would be like crazy psychotic hungry, like pregnant lady with 4 twins, hasn't eaten in 8 weeks, really needs to eat something crazy. No, it was psychotic. It was like this psychotic hunger. And I was freaking out because the way my surgeon does it, you're NPO for 24 hours, which means no water by mouth and no food by mouth. And if you've been a binge eater, it's like, holy crap, this is like the end of the world. Worse than it. And I was able to do it without thinking. My blood sugar fasting the day of surgery was 170, probably elevated because of the stress. The day after, my fasting blood sugar was 79.
Oh, yeah.
Which it had never been, like even no matter what diet I had been on.
Wow.
But
that's your instant metabolic advantage right there, isn't it?
Yeah, so mine is actually atypical because usually it takes a couple days, but there is so for people who are severe, like in a severe state of health and they can't wait 2 or 3 years, surgery is a better option in that regard. If you've ever weighed over 400 pounds, surgery is a good option, partially because it also compensates for behavior. And that goes into my experience, I think, Carl, is a lesson in the power of behavior, actually.
Yeah.
Because behavior I look at obesity as a dysregulation of hormones.
Yes.
And that paired with maladaptive behavior. So we're not talking about, the skinny type 2 diabetic, which actually there are a lot of people who are skinny type 2 diabetics.
Toffies. We're going to do a whole show on
We're going to
toffies.
do a show on them one day.
Yeah.
I mean, and I think that's actually very important because people don't realize, hey, I'm skinny. Well, I'm healthy. Well, no, you're not. Shut up. But anyhow, I shouldn't say that because I'm a counselor. But when you're talking about obesity, and you have like an abundance of adipose tissue. Fat, people don't realize, is an organ.
Yes.
Right. Which we learned last week.
Oh, hey, look, I'm advertising for, Ivor. So fat is an organ, and people constantly don't realize it. And it's actually important. We need it. Women need fat to have babies.
Yep.
If you're too skinny, you're not going to have periods. If you're too fat, you're not going to have periods either, and you're not going to be able to get pregnant.
Right.
Even men need some fat for hormone regulation. So that's the issue. And weight loss surgery maximizes our ability to manage it because it regulates hunger and fat gain are very complex, and ketogenesis naturally resolves it. And so does fasting to some degree.
Yeah.
But the thing is, you have a permanent metabolic benefit with the bile acids. For example, the bile acids affect your gut microbiome in the small intestine, and that's a factor in obesity. You have permanently reduced ghrelin, which means if there's less ghrelin in circulation, using the growth hormone receptors. So this is just a theory. Okay. But then what can use those receptors? Well, then growth hormone can use them because you reduce ghrelin.
So let's continue this conversation with Daisy Bracken Hall. Hi, Daisy.
Hi, Carl.
How are you?
I'm good, thank you. Really excited to be here.
Yes, and we're excited to have you. Let's hear your story.
Okay, well, mine's quite different from the other two, and I feel ashamed in some ways that I've just stumbled along. There's no more research these days, but I knew nothing to start with. I've always had a difficult relationship with food for as long as I can remember, really. Certainly from my early teens, I've had that typical gaining weight, losing weight. I think I did my first official diet age about 14, 15.
Wow.
Yeah. So I've really been going up and down since then. And always linked to emotions with me. Food has always been either something that I try to comfort myself with as a treat. It's an easy treat, right? It's, you learn from an early age that a chocolate bar or something, it's something delicious and it's a treat. So if you're feeling unhappy, then the easiest way to try and change that to being happy is to have something. Exactly. And it's a cheap and easy way to do that. So I've always done that. And later on, I've actually used carbs, especially I learned were a numbing type medication, if you like. So I could, when I got really unhappy, I just wanted to be out of it, basically.
Right.
And I've never turned to drugs. Which would probably have done it faster and more effectively, but luckily I've never done that. But I use food, so I found that by eating a lot of carbohydrates, it would make me sleepy. I'd go to sleep and I'd be asleep for ages, and I wouldn't have to be unhappy because I was asleep. So from probably my early 20s, I was diagnosed with an underactive thyroid. And I suddenly thought, I'm just gonna lose weight. This is amazing. But the doctor said to me, no, he said, unless this has specifically caused your weight gain, it's not going to solve the problem.
Yeah.
And it didn't for me. I also saw a psychiatrist at the time who told me officially that I had depression. This is what all this unhappiness was. It had a label, and apparently it had a cure, which was Prozac, basically.
Sure.
Except that never worked very well. And I basically just carried on gaining weight, losing weight, gaining weight, the normal sort of cycle, and all the things that people do, Weight Watchers, you name it, I've done it. And I moved to France and the problem just continued. And one day, one of my long phone conversations with my mum, talking about how unhappy I was and how fat I was and how difficult it made everything. I was a garden designer, trained as a garden designer in the UK, but when I came to France, really all the work I could get was garden maintenance. And when you're 134 kilos, which is what I got to, that's actually really hard to do. And I would come home and just cry at the end of the day because I had welts and sores from in the summer when it was so hot, and everything would rub, and I would just have these sores, and everything was hard, everything was painful and awful. And my mum said to me, you should go and see the doctor, because here in the UK, people are getting this weight loss surgery done on the NHS. You should go and see your doctor. So I thought, well, why not? What have I got to lose? So I went to my GP, and he referred me to a bariatric surgeon. And
this was in England, right?
No, this is in France.
In France, okay.
Yeah. And so I saw him, and he did the usual, worked out my BMI, and straight away said, right, yeah, we have this great surgery for you. It's called the band.
Oh, dear.
Yeah. And so, but of course I didn't know anything about it. And for me, it was this lifeline. It was something that the surgeon was going to do. He was going to put in my body, and it was going to solve all my problems.
Right. It was a heroic intervention, which certain kinds of surgeons make their living out of.
Yeah, that's right.
Yeah. And he, actually, to his credit, he has changed over his career and no longer performs the band, but I'll come to that later. So, yeah, he said, okay, this is what we can do. And I was, great, this is the answer to all my problems. So I had the band. And to start with, nothing really. Oh, and he took my gallbladder out first, because he said in his experience, a lot of people tended to have issues if their gallbladder was at all, had potential for problems, which mine did. It turned out it had stones in it already. He said after the surgery, you can have real issues, and it will have to come out under emergency surgery. And I've heard a lot of stories about that, actually. So yeah. Although I think potentially I have problems with not having a gallbladder, on balance, I'm quite glad he took it out. So I had the band, and to start with, nothing happened. I'm like, okay, so I can still eat completely normally. I went back to see him, and I needed a fill. So he injected, as Donna said, you have this port under your skin, which basically they stab a needle in and inject saline, and it fills up the band, and it increases the restriction.
Can they reduce that as well with the same process?
Yes. So they put the needle in, and they take saline out. So you can go either way, and you have to continually adjust. Wow. So I came home, and it was just before Christmas, and my brother came over, and I made this, fantastic normal sort of roast dinner, and I discovered straight away that I could hardly eat anything, and what I did eat, I would throw back up. So I would probably only consume maybe 10% of what I ate, which wasn't very much. And I was so desperate that I thought this was fantastic. I thought it was great that I could eat anything I wanted to. I couldn't eat very much of it, and I would basically regurgitate it. It sounds gross, and it was gross, but it wasn't like sick. Because you were literally just regurgitating food. So it actually wasn't quite
It didn't have a lot of acid in it, in other words.
No, none at all. So you ate something, and then you tasted it as it came back up again, exactly as it went down.
Wow.
Yeah. So I thought this was great. And that carried on for about 6 months, until basically when the summer came around and it was really hot again, I started fainting when I was working because... Well, basically,
you weren't getting any nutrition.
I was suffering from malnutrition. Yeah. So I thought this isn't good. However much I like the fact that I'd lost about, I think, 20 odd kilos by this is not right. I can't actually function. So I went back, and they tried to take some of the saline out, and that was the first time they discovered that my port had flipped round 180. So they're stabbing away with the needle, and they're pulling the X-ray machine in. What's going on? We can't get this needle in the hole. And they discovered that it had flipped round 180. So the hole, why they don't have holes on both sides, I don't know. But the hole couldn't be accessed because it had turned round towards my insides. So I had to go in and have an operation to switch it round. And although everything was keyhole, actually where they put the port in was maybe nearly 10 centimeters across the scar. So I did that, and basically that happened twice. So further on down the line, the exact same thing happened again, and I was like, well, how does this happen? Are you not sewing it in properly or something? Because I have a reasonably active lifestyle. I'm a gardener, but I'm not doing anything that should make it undo itself and flip round. But so twice that happened. And so everything carried on. Really, I never really got on very well with it. Then I started to have real regurgitation problems during the night, where this brown foamy liquid would come up. Oh. And it was horrific. And
so you aspirated in your sleep, really?
Yeah, and to the point where I couldn't sleep horizontally. So I would sleep in an armchair to keep myself upright, and I would have a container next to me because this stuff would come up. And I suppose I just got into the habit of almost subconsciously, not really fully awake, just sort of spitting this stuff out in my sleep.
So you had to sleep upright, so you didn't drown while at night.
Basically, because if I was lying down, I would start choking, and it would get really awful. So this carried on for quite a long time, and I actually went to the UK on a visit to see my family when I had it, and it was just embarrassing because I would be given a bedroom to sleep in. I would always have to find my way to the sitting room and end up sleeping upright and just spewing this stuff out. It was horrible. And also it would make me cough a lot during the day, and it would come up. I've had to run to the bathroom in a restaurant before because I think I was in a Thai restaurant, and a bit of chili caught in my throat, and I started coughing, and the liquid started coming up. So these awful things, and would cough so much that I actually lost my voice for 2 weeks. Not good. I thought, okay, well, this is obviously not right. So went back to the surgeon. Okay, we'll have a look. We're the only way really we can find out is to go inside. I think they might have done a gastroscopy actually, and they couldn't really sort it out. So they said we're going to have to put you under and go in and have a look and see what's going on, which they did. And as Donna mentioned, the band had slipped, which is why I was having all these problems. And
because things move around, especially if you have an active life. Yeah,
exactly. So they replaced it. So I came back out, and everything was reasonable for a while. But then I just had this issue where I felt like I had a lump in my throat all the time, and every time I ate anything or drank anything, I would have to then drink at least 1 litre of water to sort of make it go down, stop this lump in my throat. Totally bizarre. I would wake up in the morning and have a sip of water. I would still have to drink 1 litre of water to get that bit of water down. It's just, this is just weird. So everyone got used to me. Every time they fed me, they had to give me liters and liters of water. So I was, always peeing, always drinking water. I was so well hydrated. But obviously I came to the point, I can't go on like this. This is not right. So I went back to the surgeon, and he said, what's your problem? That sounds great. You can't eat much. You're drinking loads of water. I said, well, yeah, but it's not, I can't live like this. It's not right. And I had another gastroscopy, and I had another one where they put the tube down your nose. I'm not sure what that is. And nobody could find anything wrong. They all told me there's nothing wrong with you, apart from the doctor who did the gastroscopy. And she said, I was seeing lots of problems with the band. And if you start having a problem, you're going to carry on having problems forever. And so I came to the decision, I've got to have this thing out. I've had enough of it. It's coming out.
Yeah.
And the surgeon said, yep, fine. And he wanted to replace it straight away with this new procedure they were doing called the sleeve. But at this point, I'd lost faith in him. I just wanted to do it on my own. It's like, that's it. I've had enough. I'd started the Dukan diet, which in a way was a forerunner to keto when I look back with hindsight. And I was getting on quite well with it. And so I thought, no, I'm going to do this on my own. And so I did. And I did really well, actually, for about a year. And I carried on losing weight. And I got to the point where I went back to the surgeon and saw a plastic surgeon and had a 360 body lift, which is basically to get rid of the big overhang that you can end up with when you lose a lot of weight. I think I was about 85, 87 kilos at that point. And they basically cut all the way around in like a huge belt, and they take everything out and they sew you together. I used to say it looks like, I used to make a joke saying I used to be a magician's assistant, and it went a bit wrong because it looks like I've been cut in half. Yeah, exactly. So that was great. I'd got rid of this big overhang, and I felt good, and everything was going well. And then it stopped going well. And from I think it was towards the end of the summer, from about September to the end of the year, I gained. So in about 4 months, I gained 6 stone.
And how much is a stone actually?
A stone, it's around 6 kilos. So you're looking at about probably
13,
close to 40 kilos.
14.
40 kilos, yeah.
Yeah, so I literally ballooned, and I went a really weird shape because I'd had this body lift. So, and I just lost it again. It just gone, and it was all down to carbs, of course. And I'd had no support with the band, so there was no support group, there was no one to talk to. Everything lacking. And then I found online, again, I think my mum had heard something on Radio 4, and I started getting online, and I found these weight loss surgery forums and groups, and started finding out what my options were. And convinced myself I wanted a bypass because I want the most restrictive thing going. I'd heard about this dumping syndrome, which bypassers can get, but it turns out a lot of them actually don't. That if you eat too much sugar or fat, because of course fat was still the devil then, you would have this dumping syndrome where you'd basically be really ill. You'd get diarrhea, you might vomit, you just feel awful. And I thought, well, this is great. This is going to retrain me. Exactly. That's the point of desperation that I was at. Mm-hmm. I just wanted to have something that would take this away. I can remember eating a tub of Haagen-Dazs, which was always my favorite ice cream. This is my sort of self-medication, I guess. Eating it, tears streaming down my face, so unhappy, so miserable. Eating this stuff that was trying to make me feel better, but it wasn't making me feel better. And so just in this awful, awful place. So I went straight back to the surgeon. I said, right, I want this bypass. I just want you to solve this problem. And he got out his chart and he worked out my BMI, and he said, no, we can do the sleeve. He said, I don't want you to have a bypass. You're too young. There are too many complications. And just on balance, it's not right for you. But the sleeve is. And so I said, yeah, great. We'll do this. And I knew a bit more about it. I knew what to expect, and I had this support network online. So I had the sleeve in, I think it was 2014. So just coming up to my 3-year anniversary, actually, in May this year, and it was fantastic. I was in hospital for quite a long time. I was in for about 8 days and just kind of went insane. But it felt great. I could straight away, they put me on mashed up food. I was eating normal food. Apparently I could eat whatever I wanted to. I just couldn't eat very much. So, and the restriction worked fantastically well immediately. And I was just amazed, you know, I ate a few spoonfuls of food and I was full.
Yeah. It's
fantastic.
interesting that both you and Donna and Louise all had this same surgery, and the way that it takes out the part of the stomach, as we mentioned before, in case you are just listening for the first time here now, you took out the part of the stomach where the ghrelin is, and that also has a way of reducing your insulin. So you naturally are not going to get those cravings as much.
That's right.
Or did you?
If only.
If only. If only. In theory, I actually still had quite a lot of hunger. That never really went away for me. But I was full very quickly. I literally could not eat more than a certain amount. And so that side of it was really good. And the weight fell off. I followed all the advice I was given, which is basically a normal diet, but less of it. So they still tell you, you know, you've got to eat your carbohydrates, but it comes after. In a way, it's good advice. Eat your protein first. Yeah. And then what's left, you put in carbohydrates. Right. No mention of fat, of course, other than you need to keep it low.
Yeah.
Of course.
Crazy.
Yeah. So I carried on with that and you know, lost weight, did really well. But I was still having problems with carbs. And the thing with the sleeve is the restriction seems to work really, really well with protein and fat. But when it comes to carbohydrates, certainly when you're after, say, about a year, but certainly after 2 years, that restriction really starts to wear off, especially when it comes to carbohydrates. So I would slip back into carbs and even doing exactly as I was told. In fact, the dietitian I went to said I should be eating a third of a baguette with every meal.
Oh my gosh.
Exactly. How crazy is that to eat a whole baguette a day? I mean, I know we're in France.
You went to a French dietitian though, didn't you?
Exactly. We're in France. But I mean, yeah. I mean, come on, that's crazy advice. So I basically sort of stopped listening to them, but I still thought, you know, there were healthy carbs. And actually, this is when I had an argument with somebody on one of the Facebook pages, and people who know me, I do like to get stuck into a debate. And that's how I learn. And that's actually how I found low carb. A person who's now a really good friend of mine, Kirsten, started telling me about low carb, high fat. And she said, you know, you should be looking at this. You don't need carbohydrates. Of course you need carbohydrates, I said. You know, I'm not talking about all carbohydrates. I'm not talking about the bad ones. I'm talking about the healthy ones. You have to eat these for your brain to function, and et cetera, et cetera. She said, no, you don't. You don't need carbohydrates at all. But instead of just arguing with me, she said, she did exactly what you guys do. She said, look at this website. Look at that website and look at the science, and you'll see that what I'm saying is right. And being naturally really curious, that's exactly what I did. And I started to realize that what she was saying was true, and sugar was the problem. And I looked at websites like the Diet Doctor and got into the whole LCHF thing and started to realize, this makes sense. And wow, all of a sudden my sleeve is working really well again. And so I carried on with that and did really well with it. But the level of carbohydrates, even though they weren't high, I was still struggling to get rid of the cravings. And I would easily slip into having too many carbs and then ending up going on a bit of a free fall, eating all the really bad carbs. And gaining weight again. And that was the position I found myself in last year. I got down to my target weight of 10 stone, 63 kilos back in April, I think it was last year. And then all of a sudden when I was there, everything went out the window a little bit.
Really?
And I started putting on weight again. I thought, you know, I'm here now. I can do whatever I like. and started eating too many carbs again, got into the where it always happens with me, whereas it's totally tied to emotions and my depression. And I was getting up in the middle of the night and eating ice cream again, and all these things. And I went back up to, in September, I was at 78 kilos. And that's when Kirsten, again, thank you, Kirsten, such a good friend, told me about the Two Keto Dudes Facebook page. That's when I found you guys and came on and started asking really silly questions like, how can you do this long term? I can't imagine it works great to start with. I've been there, I've done it. It's really easy when you're all militant and new but when it wears off, it's so hard. But basically, to cut a long story short, that what people were saying made me excited enough about keto to give it a go. And I did. And what I found was that restricting carbs that bit more actually took those cravings away.
Yes, sir.
And I thought, this is just amazing.
Yeah.
And so, as you know, I'm really behind keto now. I'm still someone who, I do have the odd slip. It hasn't happened for a while now, but the last time was when I went back to see my family in November, and I just fall into that pattern of eating some carbs because I don't want to make a fuss.
Yeah.
I don't want to put people out. But what happens is that I start eating them, and the immediate impact for me is my brain and my mood. And it's the depression that comes back. Yeah. And of course, when that comes back, my instinct is to go back to the old comfort eating habits.
Sure.
And I'll end up in this downward spiral.
And now we have our own comfort food. I think one of the things that has kept me on it so much has been my love of cooking and being able to explore all the different foods that we even talked about on this show. I know I can have chicken parm if I want. I just got to make it with keto breadcrumbs. But I've never been deprived this whole journey, and I think people get to that place that you're at, which is, other people's feelings aren't worth my early death.
Yeah,
and it comes down to that.
Yeah, and I've actually been seeing a counselor online for over a year now, and I know that food and emotions are so tightly linked with me, and we've been working on this over time, and I've really come to the place. In fact, I was talking to him about this on Friday with our last session, saying, what's weird now? The easiest thing for me to do first when I'm in that downward spiral with depression, and what happens with me is that I just I turn in on myself and I become a real hermit. I don't see people, I don't exercise. All I want to do is sleep, be at home with my dogs, eat, whatever. But the thing that's really changed is my approach to food now. It's the thing that I find most easy to get back on track with. One, because I know that it's going to have an impact straight away on the way I feel, but also because I love keto. And just as you were saying, Carl, I can make myself the delicious things. I can make myself alternatives to the kind of foods I used to like.
Yeah.
And I can do them all keto now, but also the food and hunger, and it doesn't have the same hold that it used to have on me. I mostly just eat one meal a day, really. I just don't feel hungry. I'm losing that automatic, instinctive response to turn to food when I feel miserable. And I'm starting to try different things. When I last felt really bad, and a couple of weeks ago when I had this overwhelming pain, like a kind of pain that you have with a headache or something, but it was pain. I knew it was depression pain, and there was nothing I could do. There was no tablets I could take. There was no food that actually I wanted to have. I didn't even want to go and eat a load of carbs. And I told myself, what you need to do is get out there with your dogs, go and have a really long walk, and it's not necessarily going to solve it and take it away, but it's really going to help. And it did. So I've started to find ways, different ways of dealing with that big emotional problem, which I've always previously solved with food. And it's absolutely true what I say about the sleeve and keto being perfect partners. They go so well together, because when you eat keto, not only do you feel better, not only do you have all the benefits that we all know about, but they work so well together because that restriction comes back. So for me, and Donna spoke about this, for me, the quantity of food is an issue as well. So when that restriction works again, I can now eat what I suppose I would refer to, looking at friends and people who have a fairly small appetite. So I can eat a reasonable amount, but it's nothing like the amount that I used to eat. I just used to eat. I love the fact that now I can hear what my body's telling me, and that really I attribute to keto more than the surgery. The surgery was something that would kick in. That restriction would kick in as an automatic response, but it's keto that has the sleeve took me so far. Keto has taken me the rest of the way, and it's really got me back in touch with how I deal with food, and it's got me back in touch with being able to get a handle on my emotions a lot better. And also migraines. I used to suffer really badly from migraines. I would have a migraine every day for 2 weeks at a time, every month. And I think in the last 4 months, I've had maybe 3 or 4. So that's another fantastic benefit. Everything about keto is great. And that really has been what has made this journey complete for me. A number of these things, actually, I think a lot of the things that relate to me, the migraines and also depression, I think has to do with inflammation, and the fact that keto is an anti-inflammatory diet. I think that's something that I don't know the exact science behind it, but I think that's a major factor in what helps, and it certainly does for me. I did see some papers on how that histamine release, of which I thought that's the basis for a lot of migraine. Obviously, the onset, the triggers is a histamine release, and that the keto or the ketones actually mediates a lot of the basal cells that are responsible for those histamine releases in the various tissues. So I think you're on the right track there with the histamines. Yeah, and I think it must be hormonal as well. I know that my migraines were definitely I used to get them for different reasons. So I would get some what I would call just reactionary migraines. So if it had been a particularly hot day, for example, or I'd got too much sun, or sometimes when I got too cold, or the weather, the pressure in the air changes, those kind of things would give me migraines. But the worst ones, the ones that would go on for 2 weeks, were always triggered around my period. It was usually just the week after is when they would start, and then they would just go on and on. So I'm assuming that because keto helps regulate hormones, that plays into it as well. So I think it's probably not just one thing. I think there are all sorts of different things that keto helps with that have helped with the migraines. They haven't gone completely. I still get them sometimes, but nowhere near as much. And they were so debilitating to have those all the time. And so it's miraculous for me to not only have a better handle on my mood, and I've pretty well cut out all my depression meds now. I still have a very small amount.
That's amazing.
It really is a life changer. The sleeve changed my life. Took me so far, but keto really, and I don't know. I've been asked whether if I could have done this differently, if I could go back and find keto and fasting before I had the weight loss surgery, do I think I could have got where I am today with keto and fasting alone? And for me, I don't think so. I think that the two have worked really, really well together. I think I needed the sleeve to get me started. But if I hadn't have found keto, I don't think I would be back where I started. But I certainly would have put weight back on again, because that was the path I started to take. So
yeah, it wouldn't have worked. It wouldn't have worked for you as well as having keto has. But you probably wouldn't have had the band though, right?
Oh, definitely.
Had it all over again?
No.
If I could go back and undo that, yeah, I definitely wouldn't have the band. If ever I hear of someone who's thinking about having the band, I try and encourage them to not have it. I don't think it will be much longer before surgeons just are not doing it anymore. Like I said, my surgeon no longer does the band, only does the sleeve and bypass.
Yep.
I'm not sure it exists much in France.
My surgeon's the same. A lot of his follow-up surgeries from people having the bands were going to the sleeves as well. So that's what he was sort of saying in my consultation. But I really wanted to say thank you, Daisy, because I'm glad that you were sort of making that point about not living your life with regret, because I said exactly the same thing to my mum, that, if, the what if question about, thinking about, should I have had the surgery if I knew about keto, or, vice versa. And really I came to that point about not wanting to make any sort of regrets. You can't live your life with thinking that if only I knew about keto before the surgery.
Yeah.
And
Right.
you made that post some time ago about how well it fits together. And I really like that metaphor of a glove, how keto and the sleeve they fit so well together. And, at that time of coming to that decision about surgery as the option that I needed for that time in my life, and now, thinking about what that gave me was obviously, a bit more control and restriction, as you've put it, is fantastic.
Yeah.
And how well keto fits with that nicely now, and it controls my hunger. I'm no longer sort of, having that 2-hour eating cycle. I don't binge, as part of that eating disorder. And, I've actually finished up with my therapist only just before Christmas, as we'd moved into that supportive therapy, sort of supportive counselling. And now I've got the tools, I've got keto, I've got my sleeve, I'm just a pig and poo, really. It's great.
Yeah. I think there's also I think there's a certain amount of shame associated with it. We've had this thing done to us. Why couldn't we do it ourselves?
Oh my gosh!
And
the stigma. I think that's something that. Yeah, exactly. Donna would say exactly that. The stigma associated with, you cheating, you had surgery, you
took the easy way. Yeah.
But that was the other thing, was that, that sort of not disclosing to people, wow, you've lost so much weight. How did you do it? Well, do you go down the path of surgery and open up that can of worms and judgment? And that I really wanted to take issue with Carl's post about taking a drastic option. Well, surgery for me was a tool. It wasn't a drastic choice.
Yeah.
It was a tool. So that language about drastic, Carl.
Well,
okay.
I think that people get to a certain point when they're considering surgery that, like your doctor said to you, Donna, or maybe it was Daisy, that it should be the last resort, right? That people find that they get to this place where, oh my God, I'm going to have surgery. It seems to the general population as drastic, but I understand exactly what you're saying here, that for you it was a tool.
I do totally get, actually, looking at from an outside perspective, you have to understand that, we've got used to talking from a defensive position.
Yeah, I bet.
And because we hear all the time, oh, you took the easy way out. Well, actually, it's not easy at all.
Sure, no, of course not.
But your experience is a perfect example.
Yeah,
horrible experience you had to go through
exactly.
to get this working.
It is a drastic measure. I can totally see that from an outside perspective.
Heck, people have told me keto was a drastic measure.
Yeah, you're cutting lumps out of your body, but what you have to, and it's impossible to get into the head of somebody else. But for me, the surgery, it didn't seem like a drastic measure at all. It felt like the only way out. It was this lifeline that I was just in this sea of despair. I'm making it's really melodramatic, but it was awful. And all of a sudden I had this lifeline that maybe was going to change my life. And I don't think if someone had come to me, if I'd have met Carl at that point and he said, I've got this, amazing way of eating. And I just don't think, I would have believed it because I tried so many different ways of eating that were all heralded as a miraculous turnaround, life changer. I don't think I would have believed it, and I don't think I would have given it enough of a chance because I've tried so many things. I think I would have been one of the people who caved after a couple of weeks. Yeah. So I don't think it would have been a viable option for me at that point. But when I did find it, it felt like the right time for me to find it and really, really use it for my benefit. So I think, these things sometimes they just happen at the right time and you meet the right people. Like I found the weight loss surgery forums and Kirsten came along and she created this massive pivot in my life towards low carb, and then finding the 2 Keto Dudes page and getting involved with you lot and becoming an admin and getting into research, and now having my own Facebook page with all these amazing women. And if you'd have told me 5 years ago I'd be where I am now, I wouldn't have believed you. So it's all fantastic.
No, I feel that way too. And so remember, I'm biased. I'm actually a therapist, of course, and I work with bariatric patients. The biggest problem with medical interventions for obesity is they discount behavior.
Right.
And to be honest, even whether you're on a ketogenic diet or no matter what, the most successful people, like I look at, for example, Richard and Carl, well, you guys have your stuff together, you know what I mean, in all aspects of your life, and you were able to make these lifestyle changes.
Right. We were lucky.
Well, you're also smart, too. And there's an interesting correlation when we look at obesity with socioeconomic status, but also education and the ability to access information.
Right.
And even a lot of people who get surgery have tried low carb and ketogenic diets, though. And I think, so it could be the surgery is certainly helpful, but it could also be a confound where the support you get in the surgical process is what makes it successful.
Right.
Yeah, 100%. And for me, starting to see the therapist and really working on that aspect of my life, that has also had a huge impact. And I always say to people who are losing the weight, you've got to work on that side of it at the same time. I've seen so many people who lose a huge amount of weight and they get there and they show their before and after pictures, which are amazing, but they say, I can't see it. I can't see the difference. Or they say things like, that fat person is gone. I never want to be that person again. And I say, look, that fat person, that is the one who got you here today. She is the one who had the courage and the determination against all the odds, it seemed at that point, to get you started on this journey that's got you here today. She is a really, really important part
She's
of
a
your
hero.
life. And you need to love her and you need to cherish her. And the more you start doing that, the more you will start seeing the changes and appreciating where you are now as well as where you were then. So it's you definitely, I totally agree with Donna that working on the mind is so important at the same time.
That's one of my biggest criticism with surgery now, because to get surgery in the United States anyway and to be informed about it, well, it's like a full-time job in some ways, especially depending what surgery you're interested in. And, Daisy, you had said before you felt bad in a way that you sort of stumbled into things. But honestly, you made fewer mistakes than a lot of people I've
Right.
seen even, because you're obviously intelligent and well thought, the things you do, you think out well, rather. Mostly on the internet anyway.
I certainly think about things. Yeah, probably overthink.
But think about the average person doesn't know anything about biochemistry, doesn't know anything about anatomy. And I, like Louise, showed up at the surgeon's. The surgeon must think I'm a freaking crazy lady because I showed up with this binder with 400 pages of studies I printed out, annotated, took notes on, and I had a conversation, not at his level because I'm not a surgeon, but the average person is like, okay, that's a good idea. Okay. And a lot of people we don't encourage.
Sure.
So I'm not saying you should question medical. Well, I guess I am actually. To some degree, you should always question for any surgery. I mean, even if it's for cancer, you need to say, okay, what's the appropriate treatment? Let me get a second opinion just to see.
That's right. Verification. That's all it is.
No,
it's
absolutely.
making sure the information is accurate.
And the biggest problem we have with the medical and complex in the United States is we don't integrate that, the questioning and the pursuit of knowledge for the sake of the self. But we also ignore the behavioral side of things. Yeah. And that's, I think, why a lot of people fail on, regardless of what diet they pick. I hate the word diet, but what way of eating they pick, what surgery they pick. A lot of people don't succeed because we don't build in psychological support. So again, I'm biased.
Agreed.
Because I am a therapist.
I think it's totally true. I support that opinion 100%.
That was an interesting question to my surgeon, was about dietary sort of follow-up. And he was absolutely not supportive of dietitians at all. He said, he was not very complimentary of them all. Exactly. So he just basically handed me a little, like a side plate. I don't know if it was some sort of product placement or something that he was given from a sales rep. He did. Yeah, which sort of basically was, this is the size of portions that you need to eat. That's all you need to do. You can have your cake and eat it too, just less of it. So that's basically what he said to me. That was my dietary nutrition follow-up. I did actually go see a dietitian, another bariatric dietitian, and I'm not sure if he was sponsored by Donna. You'll get this, the bariatric supplements people. So he put me on to those chewable, the chewable tablets, multivitamins for post-bariatric patients as well. Yeah, so I'm still taking them. They're okay. So that was really my follow-up.
Louise, you can digest the capsules now. You actually don't need to take those, but you can take regular multivitamins.
Yeah, and I think that was just really looking at a multivitamin. I think that was part of because I don't know if you ladies also had it as well, but that 3 months post-surgery, all my hair not all my hair. I have a lot of hair, but my hair fell out. That was absolutely freaky. And the other point was about my gallbladder. I ended up with an acute gallbladder attack, and I know, Daisy, we had some Facebook communication as to why this was happening, and we were reading the articles together about the increase in fat circulation and how caused, obviously, some gravel to form, certainly in my gallbladder, which is obviously still an ongoing issue for me to manage, which I'll be following up as well. So,
hilariously, even though I have lost over 450 pounds, I'm the one fat person who's never had a gallbladder issue.
Wow.
Indeed.
Right. And I haven't. I've been fine without mine. I really haven't had any. I haven't had any noticeable problems. What I think might be a problem that is associated with it is my vitamin A deficiency, and I think it's important. I think it's important to say that any person who has weight loss surgery, they need to be very vigilant about having blood tests and keeping an eye on potential deficiencies, because I just happened to have a blood test for vitamin A and discovered that I was really deficient, and I wouldn't have known. I had no symptoms, and they gave me very high dose but suspended in oil, and this is where I think it might have a link to the gallbladder, that anything that's fat soluble, it's the fat soluble vitamins that I have an issue with. And I ingested it orally. They also injected it, and I carried on getting deficient. And it was only when, again, Kirsten, thank you, told me to take dry form vitamin A, and so I self-medicated, and I've now got my levels back within norms. But that's the other thing that I was just going to say about support. I was given no support, no contacts. This whole support network that I have, and that I created that myself.
That's right.
I found those people online, and I built it myself. So I wonder what's happening to all these people who have been let go and who haven't had the wherewithal, or whatever reasons, perhaps don't have good internet access, who haven't access these support groups. What's happening to them? That worries me.
And that's why we're building out a group online at ketogenicforums.com, right, Richard?
Yeah, absolutely. I think the positive thing about all of this is that you're all working, helping other people now as admins in our group, and taking a positive approach to helping other people. And the best way I find to learn something is to teach somebody else it.
Exactly.
And
Definitely.
so, that's a real positive. One of the call outs we made when we basically got rid of the Facebook group and started up the ketogenic forums was to tell people to start up their own Facebook groups, and to start up their own local organisations and start working with people who are just starting out in this process.
Yeah.
And that's one of the things that Daisy did. She started a Facebook group of her own, of sweary women. I think it's the official title or something.
It's funny. It's actually called Kick-Ass Keto Bitches. We're fierce,
right.
But the interesting thing is that started out really just as a bit of fun. The thing that I suddenly realised I was going to miss from Facebook was the banter.
The banter,
That's how it started. However, what has been really touching is that it's working on all these different levels. So you'll get this jokey meme and all these this funny stuff, and then you'll get this deep and meaningful long thread about, there was a really interesting thread on depression, lots of women's issues, all sorts of things. We're basically just this group of women who are bound by keto and being women, and we talk about anything we like. And this group has just taken on a life of its own, and
That's so great.
That's wonderful.
And it's
that's
wonderful.
Exactly what we wanted.
Yeah,
that's exactly what we wanted when we got rid of our own Facebook group. There's
Right.
like 13,000 people there. That was the impetus we hoped for lots of Facebook groups to form, because if we kept our group around, those other new groups, kick-ass bitches, wouldn't have formed.
Yeah,
That's right.
And it's so much better, I think, to have hundreds and thousands of small groups.
Absolutely.
With this, than these few groups who get into this weird pattern of dictatorship and saying
it's terrible, isn't it?
This is, have all these rules, and we have the rules. The pin post on mine is we have no rules, and but what I think is fantastic, all these little groups that we now, of course, have this incredible hub at the center of the ketogenic forums, which we constantly direct people back. So although we'll get questions coming on saying, oh, what is keto? What is it all about? Now, I'm not going to repeat the same thing over and over again. I say, you know what? There's this amazing resource called the Ketogenic Forums. I'll look up what they're searching for, and I'll give them a link. This is where you need to go. This is, this is for the banter. This is for talking about, the things that girls want to talk about with no men around. You can talk about anything you like, but and mostly, of course, it's keto related. But I have this incredible library I can send people to, where there's all this information stored, all these people they can connect with. It's not just a case of connecting with a great article, but you go and you read that article, and then you get to talk with all the different people.
Right. Yeah.
It's incredible, and
it's
I think
really great.
Yeah, we've just ended up with this incredible resource.
And even though this resource is fairly new, we now have about over 4,000 members. And it really got a boost after we shut down our Facebook group.
And
But,
active.
yeah.
They're churning out this
They
amazing content.
We're creating this
every
huge
day.
knowledge base of information that's fact checked and really done well. Ladies, we could go on and on and on, but it's been 2 hours, and if we're going to end this show, we're going to have to come up with some recipes. Recipes.
Well, I feel like a jerk being 0 carb now, but okay.
No problem. Hey, Richard, you go first.
Well, I've got a simple one today. In fact, this is Julie's recipe. She had it for dinner tonight. And what it is keto coleslaw. Ooh. And you can make it with any type of cabbage. And normally coleslaw is cabbage and carrot and mayonnaise.
And sugar. They put a lot of sugar in it, and maybe vinegar.
Well, yeah, often, vinegar and sugar combination. So skip the vinegar and the sugar. So what we're going to do is we're going to have mayonnaise, we're going to have cabbage. Now, carrot has quite a lot of sugar in it.
Sure.
So instead of carrot, what I'm going to use is bell peppers, or in Australia we'd call them capsicum.
Yeah.
And the ratio is about 2/3 cabbage to 1/3 capsicum, but you can use red cabbage. Today we had red cabbage and red capsicum together.
Nice.
You could have red cabbage and green capsicum. You could have Savoy, like a white cabbage and red capsicum, or you could have bok choy or wombok, a Chinese cabbage. So there's lots of options, but basically what we do is we make up a bowl dry of the capsicum and the cabbage, and then that just sits in the fridge, and we have a separate container with the mayonnaise, and then you make it up on the plate as you go. So that bowl is going to sit in our fridge for probably the whole week, and we're going to be having keto coleslaw with just about every meal that we eat.
That's awesome.
So that's my recipe.
That's great, and so simple too.
So what have you got for us, Carl?
All right, Richard, I'm going to blow through this because we're going to put it up on the blog and you can refer to it there. But we had these amazing buffalo chicken meatballs. I say I didn't, but my daughters had at Daddy Jack's, which is a great restaurant down here in town. My band plays there. He's got great keto food already. But this wasn't one of them. And I wanted to take the recipe and swap out in the meatballs, the buffalo chicken meatballs. I wanted to swap out the breadcrumbs for keto crumbs. And here's the idea. You can take any meatball recipe and just swap out the breadcrumbs for keto crumbs. And they can either be a combination of crushed pork rinds and grated cheese like Romano or Parmesan cheese, or just the pork rinds.
Yeah.
So here's mine. It's a miniature buffalo chicken meatballs. You know the kind of meatballs that you get at parties, the little appetizer size?
Yeah, little hors d'oeuvres.
Little hors d'oeuvres, exactly. So 2 tablespoons of olive oil, 4 tablespoons or half a stick of unsalted butter, 1/3 of a cup of Frank's Red Hot Tabasco or other hot sauce, 1/4 of a cup of heavy cream, 2 ounces of crumbled blue cheese, a pound of ground chicken thigh meat. You can use whatever you want, but of course we're talking chicken here.
Yeah.
An egg, half a celery stalk, finely chopped, 3/4 of a cup of pulverized pork rinds. I'm going to add a 1/4 cup of grated Parmesan, half a teaspoon of onion powder, teaspoon of salt, half a teaspoon of crushed black pepper. All right. So you preheat the oven to 450, and you coat a 9 by 13 inch baking dish with olive oil and set it aside. Combine the ground chicken, the egg, the celery, the pork rind dust, the Parmesan, the onion powder, salt, and pepper in a large mixing bowl and mix by hand until thoroughly incorporated. That's the fun part.
Yeah.
And then you roll the mixture into round 3/4 of an inch wide balls. If you want to make them a little bigger, that's fine. But you got to make sure to pack the meat firmly and place them in this baking dish next to each other so that they touch. And that ensures they'll be soft and moist. It's a chef trick, and you know this, Richard, that if you're frying something in a pan or it's in the oven and you have more than one item, if you want them to be crispy, you separate them. You give them space.
Yep. Let the air between them,
Yeah, and if you don't want them crispy, if you want them to be more tender, you crowd them out. You crowd them together. So while the meatballs are roasting, you combine the butter, the blue cheese, the cream, the hot sauce in a small saucepan. Cook that over low heat, whisking until the butter and cheese are melted and fully incorporated. And then you roast the meatballs for about 15-20 minutes or until firm. And if you really want them perfect, roast them until the meat thermometer in the middle of the meatball registers 165 Fahrenheit. And then you simply toss the meatballs in the sauce and you serve and enjoy.
I love thigh meat. Doesn't that sound good?
Buffalo chicken
Sounds
meatballs.
yummy.
Yeah. Ladies, thank you so much for joining us. Louise, thank you.
Thank you so much, Richard and Carl.
Donna, thank you.
Oh, and thank you guys for all your hard work. We really appreciate it very much.
And Daisy, of course.
Definitely.
Thank you so much, Daisy.
Thank you. I've loved it. It's been fantastic.
We are going to continue this conversation at www.ketogenicforums.com. We have a category called the Two Keto Dudes podcast, which is under resources.
Yeah.
And I always publish the new show there. And we actually had a couple stories that were emailed into us, Deborah and Frank. And guys, I'm sorry we didn't get to you, but I'm urging you to post your stories as well here in this topic. And we will provide a link to that on the show notes. So there you go, Richard. That's a show.
Yeah, awesome show. It was a long one, but with 3 guests, with 3 awesome stories, I think it's worthwhile going a little bit long every now and then. And the other good thing is this is our 52nd show, so that's a year.
That's a year.
Happy birthday.
Happy birthday.
Happy anniversary.
Yeah.
Happy first birthday to you and Carl.
You're welcome.
Yeah.
Goo goo gaga.
Thank you. Thank you.
We're just getting started.
We are just getting started. We've got a whole lot more that we
Yeah.
have planned for this this little adventure of ours. Of course, if you have anything that you want to tell us, something we said wrong, something you don't agree with, or some more research that you found to support or refute anything that we've said, send it by email to dudes@twoketodudes.com or post it on our website or on the Ketogenic forums.
Absolutely. And you can follow us on Twitter at 2KetoDudes, on Instagram at 2KetoDudes. And of course, if you want to join our forum, it's www.ketogenicforums.com or forum.2keto.com. And if useless swag is your fancy, you know, t-shirts, coffee mugs, and other junk with keto sayings on them, head over to gear.2keto.com.
And if you feel like supporting our podcast and our forums, hit the donate button on our website at www.2ketodudes.com, or you can just go to donate.2keto.com.
Absolutely. Okay, Richard, keep calm and keto on.
You keep calm and keto on, Carl.
Keep calm and keto on, ladies.
Keep calm, keto on.
All right, we'll see you next time on Two Keto Dudes.